Now let's move to banding of molars. Yes, we can do banding of other teeth as well, but in today's day and age, we do not band any other teeth except for molars. Okay. So first things first, we require something called as a separator placing plier and separators. So the plier that you see in front of you is a separator placing plier, and what you see, the blue color elastomers, are separators. So even before we start the process of banding, we need to create space for the band to actually go between the teeth. Okay, so first things is you need to have a separator placing plier and then a elastomeric separator as well. So now these separators are placed mesial and distal to the teeth that we are planning to band. You can see in the video that how by sliding buccolingually I place the separator. So we are planning to band the sixes. So a separator mesially and distally has to be placed. So we are bending both the molars. So in total, we need four separators. Now you have to be very careful and gentle when you are placing these separators. Otherwise, the tip of the plier may hurt the palatal surfaces of the patient. Right? So we are done with placing the four separators. So what these separators actually do is these separators will create space. They will technically separate the teeth. They will give you approximately around 0.5 mm of space. Right? If the separators remain in place for a period of a week or so, you are blessed. See, because separators, what they do is they start interfering with the occlusion also. And many a times what may happen when the patient is eating food, the separator might break or it might dislodge. So you will have to instruct the patient to not eat something that is very chewy or hard, and also to not clench too much. Okay, because as you can see, the separator is circular in shape. One part of the circle is above the contact point and one part is below the contact point. So the separator is trying to shrink and push the neighboring teeth away from each other. So your average duration should be around 4 to 6 days. I will put the separators today and I will recall the patient after 4 to 6 days, and then I start my binding procedure. Okay, we do not put the bands today and we will not be able to measure for the, we will not be able to put the separators today and band in the same day. So you will on an average have to recall the patient after 4 to 6 days and instruct the patient to follow proper precaution so that the separators remain in place for those days. So if the separators dislodge for whatever reason, if they break for whatever reason, you will not get the desired space for you to place the band. Okay, so it is very, very important for you to understand that separators need to remain in place till the time you make your bands. Another way of placing these separators is by using a floss tie. You can simply stretch it using a floss and slide it between the contact and allow the separators to be there. Okay, the protocol remains the same. Around 4 to 6 days you recall the patient for your banding appointment. Right? Another use of these separators is in a severe crowding situation. So when the teeth are tightly in contact, they are overlapping with each other, you want them to be slightly pushed away naturally. So what we do is we place separators between these teeth and allow the teeth to move a little, and then we start the process of moving the teeth. Okay, so this is another function, but predominantly to create space for your molar bands. So these are elastomeric separators. The disadvantage of these separators is they are slow and they might dislodge also. They might get dislodged, they might break, right? So because of these, in few cases where there is non-compliance issue or heavy bite issue, we prefer giving these Kessling separators. The mode of working remains the same. One end of the spring, now these are basically springs. One end of the spring goes below the contact area, one end of the spring goes above the contact area, and then you activate the spring so that they come close to each other and push the teeth away. So what will they do? The two arms will try to push the contact, try to pass through the contact area and push the teeth away. Now this is uncomfortable. It's slightly traumatic to the patient also, but this works faster. So if you're pressing on time, what we try and do is we do it in the morning, and in the evening we are doing the banding procedure. These are readily available in the market also, or you can make it chairside. Okay, so these are called as Kessling's separators. These are faster, a little traumatic, but then if you are short on time, you can choose to use them as well. Right? So now once you have space, now starts your actual banding protocol. So for that, you need a band pusher. Now this is one of the most dangerous instruments, a band pusher. The reason I say this is if it slips, it will hurt the patient a lot. So when you're working with this instrument, make sure if it pushes, if it slips, it does not hurt the patient. You will require a band remover, right? So I'm gonna show you a video where the entire banding protocol is done. Now this is how prefabricated bands are available with different companies, but this is how your prefabricated bands are available. So UR means upper right, UL means upper left, LR means lower right, LL means lower left. Okay, so this is what this signifies. 3-4 is the size. It is not of the first premolar. 3-4 or 34 is the size. 35 is the size. 35 plus is the size. Size is this circumference basically. Is just a way of categorizing. Okay. 36 is the size. 36 plus or 36 plus again is the size of the band. It does not refer to the tooth number. We as dentists, for us 3-4 is third quadrant, fourth tooth, which is the first premolar. No, these bands come quadrant wise, which they are telling you by upper right, upper left, lower left, and by 34, 35, 35 plus, 36 plus, they are telling you the band size. Okay, the most common sizes that are used are between 36 and 38. In the beginning, if you have an extensive practice, in the beginning you can buy the entire set, use as per requirement, and then you can purchase refills also. Now these prefabricated bands are available without a molar tube on it, and if you want, you can procure prefabricated bands with molar tube welded on it. So you can have with tubes and without tubes also. Okay, so these are your prefabricated bands. Okay, So this is how they will look. They will be contoured nicely, and every band will have the number on it as well. UL means upper left. 20 is the size of the band, and this band comes with a pre-welded molar tube to it. Okay, you can see that the molar tube is there. So this band is a prefabricated upper left size 20 with molar tube, and this band is a prefabricated, here the size is not visible, prefabricated without tube. Okay, and the orientation of the tube remains the same. Orientation of the tube remains the same. It has to go gingival and distal pointing. Okay, this is your bands. So if you are someone who is uh, procuring tubes separately, you have to understand the tubes that you regularly use have this mesh on it, right? Just like your bracket has this mesh on it, but the tubes that are welded to the bands have a plain surface. This is a bondable tube, and this is a weldable tube. On the tooth surface, on the enamel, bondable tube. On the band to be welded, a weldable tube. Okay. So again, you have to understand categories also. Both are tubes only. Both might be of 1/6 only, but one is a bondable tube and one is a weldable tube. This is how your bands look in the patient's mouth. So for if you are making a custom band, you do not wish to, procure prefabricated bands, or if you're someone who cannot constantly keep on buying refills and you want something that fits perfectly, then you can start making bands on your own. This is what we used to do earlier. So you need to then buy a band material. Now this is a band material, right? And a band cutting scissor. You cannot use your regular scissors. You have to have a band cutting scissor, and you will require band pinchers. You will require band pinchers. Now these pinchers come in set, left and right, these band pinchers. So it will help you tightly squeeze the band material around the tooth, right? So for your band to properly fit, it has to be adapted really well at this stage, right? You can choose to invest in these. Otherwise, I will show you the kind of instrument that I use. You then pinch and then you weld using a spot welder. Now this here is your big investment. Routinely, your prefabricated bands will cost you around 10-12,000 rupees. Okay, the entire set. But if you're going in for custom bands, then you require a spot welder. Same amount of investment would be required. So depending upon what work you're doing, you can choose to go in for a prefabricated bands or a custom band, but then you will require a spot welder as well. Okay, so once you are done with your welding, you cut, trim your band, and then you place it in the patient's mouth. So just a quick video. I'll just take you through everything. Now this is a separator placing prior. The band material, the band cutting scissor, the band pusher. This is the band remover. It's a slightly different style of band remover than you saw earlier. Now this here is a straight hoe with a flat tip. This is not a band pincher. This is a straight hoe with a flat tip. Now this is what I use for my band pinching. Okay. I will take a band material approximately finger length and then cut the desired length. Now I will start adapting it around the molar. Now one very important clinical tip is when I am adapting it at this stage, I will make sure I press it with a finger on the labial aspect. I push it properly from the labial and then that is the circumference. Now I go to the spot welder, weld it, and this is what I have. Okay, you see the welding line, the black line that is there. Now at this point, I will cut the excess. I will cut the excess and fold the band using the same instrument. The folded part I will weld again to keep it down, trim and contour the band at this stage. Once you are done with trimming and contouring, then you place the band onto the tooth surface. It will be a little tight at this stage because of the weld. You take your band pusher and push the band down. Mesially, distally pressure, and I will use the tip to contour it in the grooves and the margins also like that. Okay, now my band is ready. I need to contour it gingivally, and if you want to remove the band, you see which tip is going occlusally and which tip is engaging the band, and just close, the band will easily come out. This is your banding protocol. So we are at the end of this webinar. We can start with our questions if there are any.